Virginia hospitals face $26 billion loss due to federal Medicaid cuts. Virginia's healthcare landscape is on the precipice of a staggering upheaval, potentially losing up to $26 billion over the next 14 years as a result of recent modifications to the Medicaid program under a federal tax and spending law signed by President Donald Trump. This bold legislative shift, heralded as the One Big Beautiful Bill before its enactment on July 4, threatens to drastically limit federal support for Medicaid, the essential program designed to provide health coverage for low-income individuals, families, children, pregnant women, and people with disabilities. A shocking shift in federal support. The implications of this law are profound, introducing an array of new obligations for Medicaid beneficiaries and imposing restrictions on taxes that hospitals can levy. According to the nonpartisan Congressional Budget Office, a staggering estimate suggests that by the year 2034, 10 million fewer Americans will have health insurance. For states like Virginia, which have expanded Medicaid, there are even more stringent requirements on managed care organizations, MCOs. As of 2028, these organizations will be compelled to reduce provider payments by 10% annually until they align completely with Medicare reimbursement rates. The numbers speak volumes. Chris Gordon, the Chief Financial Officer of Virginia's Department of Medical Assistance Services, DMAS, presented alarming projections to state lawmakers, indicating that these changes could result in a dramatic $26 billion funding shortfall over the designated 14-year period. This reduction is particularly notable because MCOs in Virginia traditionally compensate providers significantly above the Medicare levels. Gordon expressed to lawmakers that such a financial loss poses severe risks to the state's economy. He remarked that the cuts will generate an economic shock that will ripple through not only the hospitals but also the broader state economy. Gordon warned of a potential decline in the workforce as hospitals might resort to reduction in staffing, and some individuals may choose to relocate in search of employment opportunities elsewhere. Contrarily, a spokesperson for Governor Glenn Youngkin questioned the accuracy of Gordon's assessments, stating that his claims were not grounded in an official analysis from DMAS. Peter Finocchio, the governor's spokesperson, emphasized that any economic implications should be scrutinized by finance experts in the healthcare field. Controversial Medicaid reforms. Finocchio's statement further introduced a contentious issue surrounding work requirements for able-bodied Medicaid recipients, mandating that individuals engage in 80 hours of work, education, or community service monthly. He asserted that the reforms in the One Big Beautiful Bill aim to reinforce accountability measures against individuals who misuse the system, while still ensuring vulnerable populations have access to necessary benefits. This viewpoint, however, may not be universally accepted, as illustrated by a 2018 study from Virginia's Joint Legislative Audit and Review Commission, which indicated that about 7% of the Medicaid expansion population might be deterred from enrolling or may abandon the program entirely due to these daunting new work requirements. A June study from the Urban Institute also highlighted that a significant majority, 69%, of Medicaid expansion participants are actively engaged in work or schooling, while only a mere 2% cited disinterest in employment as their reason for non-participation. Critics of the proposed work requirements contend that these measures are counterproductive. Rather than fostering job growth, they may erect barriers that could lead to increased numbers of uninsured individuals. The ripple effects of reduced funding. The law stipulates that state-directed payments, which contribute to covering Virginia's share of Medicaid expansion costs, will face gradual reductions. Presently, the federal government covers 90% of the annual expenses for Virginia's Medicaid expansion population. The state compensates for the remaining share through a 6% tax levied on the revenue of 63 private acute care hospitals. Starting from October 2027, the new federal mandate requires Virginia to diminish this tax by half a percentage point each year, ultimately reaching a cap of 3.5% by 2032. This shift is projected to result in a substantial financial deficit for private hospitals, estimated at nearly $24.8 billion over 14 years, with prominent institutions such as VCU Health System and UVA Medical Center facing a cumulative loss of $1.2 billion. Concerns from hospital representatives. Julian Walker, the Vice President of Communications with the Virginia Hospital and Healthcare Association, underscored that the law's Medicaid provisions could cost Virginia hospitals approximately $2 billion annually, highlighting how projected declines in state-directed payments constitute about 16% of total net hospital revenues, and even higher for hospitals serving elevated numbers of Medicaid patients. Walker expressed skepticism about any organization surviving after losing 15% to 30% of its revenue due to a policy decision. A critical focus has emerged on rural hospitals, which already grapple with severe financial strains and are increasingly at risk of closure. Walker noted that such funding cuts would exacerbate an already dire situation, as these facilities tend to treat a larger proportion of Medicaid and Medicare patients while also struggling to attract and maintain adequate staffing. The future remains uncertain. A June analysis conducted by the Center for Healthcare Quality and Payment Reform identified 7 rural hospitals in Virginia facing immediate closure risks, further stressing the system's vulnerability. In the grand scheme of things, this situation has prompted bipartisan concern, evidenced by a letter from Senate Minority Leader Chuck Schumer and other Democrats to Trump, highlighting the adverse impact the legislation could have on rural healthcare stability in Virginia. Despite the $100 million grant program included in the law for rural health transformation, aimed at mitigating some of the funding losses, challenges remain persistent. Call for dialogue. As Virginia grapples with potential repercussions stemming from the new federal law, state lawmakers emphasize the need for continuous conversation and collaboration. With upcoming meetings to discuss these vital issues, the prospect of navigating the new Medicaid landscape presents both challenges and a call to action for lawmakers. In light of these developments, it's clear that the future of healthcare funding in Virginia is precariously poised. What are your thoughts on this situation? Do you believe that work requirements will effectively address the challenges of Medicaid, or are they merely creating additional barriers to access? Share your perspectives on this pressing issue in the comments below. Virginia hospitals face financial crisis amid Medicaid changes. In a dramatic turn of events, Virginia hospitals could be facing billions in losses due to the uncertainty surrounding President Trump's healthcare changes. Virginia Medicaid officials are still in the dark about the implications of these changes for the 1.9 million Virginians enrolled in the program. Cheryl Roberts, Virginia's Medicaid director, admitted to state lawmakers that they lack guidance on most aspects of their One Big Beautiful Bill. This lack of clarity is causing significant concern, especially for the 600,000 Virginians covered under the 2018 Medicaid expansion through the Affordable Care Act, who will now have to meet new requirements, including completing 80 hours of work, education, or community service monthly. But here's where it gets controversial. The verification process for these requirements is complex and could potentially lead to a loss of coverage for many. And this is the part most people miss: the financial impact on hospitals could be devastating, with potential losses of up to $2 billion annually, potentially leading to closures, especially in rural areas. While lawmakers are eager to address these issues, they need more concrete information first. The lack of transparency and specifics is making it tough for them to protect Virginians. This story is a stark reminder of the real-world implications of policy changes and the importance of clear communication and guidance. What are your thoughts on this issue? Do you think the new requirements are fair? How can we ensure that hospitals and patients are not adversely affected by these changes? Texas health insurance crisis, double whammy of rising premiums and lost subsidies. Brace yourself, Texans. Health insurance purchased through the marketplace may become significantly more expensive in 2026. This situation presents a double whammy for millions. Not only are federal subsidies that have helped keep premiums affordable set to expire, but insurers are also forecasting notable premium hikes. And this is the part most people miss: these two forces combined could dramatically impact coverage rates across the state. Texas, which already has the highest rate of uninsured residents in the nation, faces a real risk that rising marketplace costs could push even more people to skip health insurance altogether. Most enrollees will be hit hard by both rising insurance costs and the loss of subsidies that have so far helped offset those expenses, explains Matt McGuff, a health policy analyst at the Kaiser Family Foundation, KFF. Marketplace insurance refers to the health plans individuals and families can purchase under the Affordable Care Act, ACA. Nearly 4 million Texans enrolled in these plans this year alone, relying heavily on federal subsidies designed to ease the financial burden. Where does this looming price surge come from? The bigger factor is federal policy changes currently underway. Enhanced subsidies, introduced in 2021 to assist low and middle-income enrollees with paying premiums, are set to expire at the end of 2025. These subsidies expanded eligibility and increased the amount of assistance available, playing a crucial role in making coverage more affordable. Last year, Texans benefited from over $1.5 billion in these enhanced subsidies, according to KFF data. If Congress does not act to renew these supports, and so far, there's been no move to do so, enrollees will face a stark reality: they will have to cover the full cost of their premiums without the extra help. For Texans currently receiving subsidies, this could mean their average annual premium jumps from just under $400 in 2024 to approximately $850, more than doubling their out-of-pocket cost. Tom Banning, CEO of the Texas Academy of Family Physicians, emphasized how vital these subsidies have been. Federal subsidies have shielded many Texans from steep premium increases so far, Banning said. But once those credits vanish at the end of this year, Texans who shop for coverage on their own marketplace plans are going to feel a severe financial squeeze. On top of subsidy expiration, insurers themselves are preparing for premium increases not seen since before 2018. A recent joint analysis by the Peterson Center on Healthcare and KFF, examining data from 19 states including Texas and Washington, D.C., suggests a median 15% premium rise is expected for 2026. Blue Cross and Blue Shield of Texas, one of the state's largest providers, has proposed a 21% hike. Why such steep increases? Insurers cite several reasons, including rising healthcare expenses generally and the high costs of new medications like GLP-1 receptor agonists for diabetes and obesity, as well as tariffs and supply chain challenges. But there's a difficult feedback loop at play. The loss of subsidies will likely cause healthier enrollees to drop their plans, leaving insurers with a riskier, less healthy pool. This, in turn, could push premiums even higher, potentially creating what some experts warn could become a death spiral of increasing premiums and declining enrollment. This scenario threatens to disproportionately affect low-income Texans, who depend most on subsidies to afford insurance. If marketplace coverage becomes unaffordable, many might choose to go uninsured, a status linked to delayed care and significantly worse health outcomes. Studies show that the uninsured face higher mortality rates and are more vulnerable to worsening health conditions due to deferred treatment. So, what happens next? Lawmakers' decisions on subsidy renewals and the response of insurers will shape the future of health coverage for millions in Texas. Is it fair to let these crucial subsidies lapse, knowing the potential consequences for vulnerable populations? Could higher premiums force thousands into the uninsured ranks, exacerbating an already significant public health challenge? These are questions with no easy answers, but they are vital to consider as 2026 approaches. We invite you to share your thoughts below. Should the federal government renew these enhanced subsidies, or is it time to rethink how marketplace insurance is supported altogether?